of new cases per day are within the original thresholds that Dr. Kane set out. When compared with other communities with similar vaccine rates and positivity levels, Indianapolis is where we need to be to lift restrictions. In short, it was a long time coming, but Indy is ready. Now, does that speak to every individual and every case? No. Though we are lifting restrictions, we aren't so naive as to think that the pandemic is over. It is not. Mortality rates and hospitalization rates are indeed low, but they are not zero, which means that if you are still choosing to forego the vaccine, you remain at risk, especially for the more contagious variants. If you live with others who have a compromised health or immunity, you are putting them at risk. The city will continue working with the Marion County Department of Public Health to ensure that every resident can easily access this life-saving, society-restoring vaccine. So while the impact of the pandemic is still being felt in communities across Indianapolis, today serves as a turning point for our community and a welcome development on our path to recovery. I do want to take a moment to express my heartfelt and deep thanks to Dr. Virginia Kane and the Marion County Public Health Department. I have said since the beginning, Marion County is unique in Indiana. We are many times larger. We are far more densely populated. We are many times more diverse than any other county in the state of Indiana. Navigating the pandemic was always going to be an added challenge here. But Dr. Kane and her team have worked many, many long days and late nights to get us where we find ourselves today. And I will be forever grateful. Just as I am grateful to every Indianapolis resident, commuter, and visitor who helped us get here. And where are we exactly? We are now able to remove all countywide restrictions on bars, restaurants, on live venues, on museums, on gymnasiums, hairdressers, tattoo parlors. Unvaccinated people are no longer required to wear masks indoors, although you should. And Dr. Kane will talk more soon about the timeline and guidance for our schools. Let me conclude by saying this is not the end of our recovery, nor is it the end of our city's obligation to help folks return to a new and a better normal. We will continue to support those whose livelihoods have been threatened by the pandemic. We will continue to work to address the stark inequities around health that the pandemic has exposed. And we will continue to work to help residents find the good paying jobs that can help them weather the next storm. So it is in that spirit. I turn it over now to Dr. Virginia Kane. Dr. Kane.
Thank you, Mayor. I would like to take this time to just commend you on your leadership and your appreciation of the science and helping to direct our recommendations. You have had incredible staff, and our staff has enjoyed working with them very effectively and I believe efficiently. And I think because of your leadership, you've helped us in terms of a public safety standpoint, one of the safest cities in the country. So I just want to re-emphasize my appreciation of all that you have done for the community of Indianapolis and Marion County. Last weekend, I shared that all of our trends were heading in the right direction, and that we were analyzing all of the data points and percentages that helped us determine a safe path forward for our community. Today, looking at the totality of our evidence, we are now in a position to fully reopen Indianapolis. As the mayor said, we can now allow full capacity at our bars, restaurants, live music and sports venues, gymnasiums, hair parlors, museums, and more. Individuals not yet vaccinated are no longer required to wear their masks indoors, although it is highly recommended. Social distancing requirements are no longer in effect. And as a caveat, private business will still have a right here, just as throughout the state, to set their own rules. And federal regulations will stay in effect for services governed by them. So you should still expect to wear a mask at airports while using public transportation and in healthcare settings. Now, for regulations regarding schools, we're going to need a little bit more time as we're dealing with a population that still hasn't been fully approved for the vaccine. However, we know that parents and school staff are already planning for next semester, and we will continue to have conversations with school leadership to ensure our students have a successful year. And as always, I must point out that these changes are only possible because of the thousands of Marion County residents who have already been vaccinated. And while we've made great strides in vaccinating 40% of our Marion County residents, we still have a ways to go. Now, that will be our central focus moving forward, doing everything we can to get the maximum number of residents vaccinated. And that includes things like more pop-up vaccine clinics, like the 3 we held yesterday. It means things like funding 86 local organizations through our $1 million community grant program, funding targeting outreach to our harder to reach populations. And it means things like the ongoing digital ad campaign that is aimed at our young people. In just a moment, I'm going to go through our recent data, which is what is allowing us to make today's announcement. And afterwards, I'm going to invite Paul Haverson to speak. Now, Paul is the founding dean and professor at the Richard M. Fairbanks School of Public Health. We've worked very closely, and they've provided a lot of technical assistance throughout this pandemic. So today, I've asked him to give a little more color on why we're able to take this step. But first, let me run through the slides. Mark, if I could have the slides. If you look at our statewide, countywide, and worldwide, we're all seeing a decline in our number of COVID-19 cases. Next slide. But one of the remarkable things that I am happy to say is that for the first time, we have reached below 2% at 1.9% positivity of the people in our community who are testing positive for COVID-19. Remember, I said that we had to be less than 5% for at least a 2-week period. We are now out over 40 days being under that 5% positivity at the lowest ever at 1.9% positivity rate. Next slide. So of our newly confirmed cases, you will see that we have reached through June the 27th an astonishing number of cases that are below 35. And would you believe it? We're now only experiencing 26 cases per day on a 7-day average. Unheard of. Has not happened since before our April epidemic, where we are now down to as low as 26 cases, representing a significant amount of low spread of infection occurring now in our community. Next slide. When we look at the ED visits with COVID-19 symptoms, you will see that we're now seeing a slow decline down to averaging only about 23 cases impacting our emergency rooms. In our highest number of cases, we were seeing over 1,000 people with COVID-19 symptoms impacting our ER rooms. But we're now averaging as low as 23 cases. Next slide. When we look at our first-time hospital admissions, we're now only averaging on an average of 2 cases of patients with COVID-19 being admitted in a hospital setting each day. Just an average of 2 cases. When we were back in early May, having a significant number of hospital admissions per day. Next slide. And we're essentially now at the point where we are not experiencing any deaths occurring in Marion County based on our infection control efforts that we have done. Next slide. How do we compare to new cases per 100,000 residents in Marion County? You will see that when you look at Indianapolis, Louisville, and Columbus, Ohio, we've gone down to no more than 3 new cases per 100,000 residents. With Chicago and Milwaukee and Detroit at 1 and 2 cases per 100,000 respectively. Next slide. When we look at those new cases and how we compare to central Indiana, you will see that Hamilton County, Hendricks County, Marion County, and Shelby County, as well as Morgan County, were all experiencing no more than 3 new cases per 100,000 populations, along with Johnson County. Next slide. Now we continue. When we look at our distribution of cases by age, we're starting to see a smaller drop in our children under the age of 20 at 19%. But our cases with the largest number of cases seems to continue to be impacted in our 20 to 39-year-olds at 36%. So they're making roughly at least a third of all our cases. But we are also starting to see an increase in our cases between 40 and 59 years of age, and our seniors increasing slightly up to 15% of our cases. But if you combine both the 20 to the 49 years of age, or even the 59 years of age, they make up over 65% of our cases. So that middle age group, that young adult group are the ones we have to continue to put our greatest efforts in because of the number of cases that continue to occur in those age groups. Next slide. So once we break these cases down by race, we find that the highest number of cases now we are experiencing are in our Asian population when we look at these cases per 100,000 population. And so we see 9,733 cases in our Asian population. With our next highest group, our Hispanic Latino population at 9,306 cases, with the lowest number of cases occurring in our Black and African American group at 6,937 cases. But I want to express this important point to you, that while they may have the lowest number of cases for our Black and African American residents, they have the highest death rate. And they have the much higher death rates than our white, Asian, and Latino populations, and almost twice the death rate of their white counterparts. Next slide. So let's talk about where we are in terms of vaccine doses administered since December of 2020. As you can see, we were at the height of giving the most vaccinations around March and April of this year. But we're starting to see a slower decline in the number of people being vaccinated. And our lowest rate we've been experiencing since about the last 2 to 3 weeks in June. So we are having a greater number of more vaccine hesitancy related to the vaccination rates occurring. Next slide. Of the percent of Marion County residents who are fully vaccinated, we have reached the 40% mark. When you look at our vaccination rate for the people who are eligible to receive a vaccine, that rate is at 48%. And when you look at the vaccination rate of those individuals who have received at least one dose, and they have their second dose to go, we're actually at about 43, a little over 43%. Next slide. And so how do we compare in our vaccination rates compared to our surrounding counties? So you will see while Marion County is at 40%, Johnson County at 43%, and Shelby County at 43%, and Morgan at 41%, we're in the 40% range. But we also have Boone County and Hendricks County at 54%, Hancock at 52%, and Hamilton County at 55%. So we still have a significant amount of work to do ahead of us. Next slide. So all in all, when we look at the percentage of individuals we are vaccinating and we break it down by an age group, if you look down to the 12 to 15-year-olds, and we just had that vaccine available to us just this past 30 days, you will see that we're at about a 15% vaccination rate. If you looked at our 16 to 19-year-olds, we're almost reaching 30% of them. And we look at our young college age range from 20 to 24, we're reaching about a third of them at 35% vaccination rate. And if I just looked at the age group from 20 to 39 years of age, we're probably overall looking at about a 40% vaccination rate. With once we hit the 40 years of age to 49, we're now starting to see about 50% of them vaccinated. And we have done the best. We've done the best in our 60 and older, where overall we've had at least 70% or higher of them being vaccinated, with 80% of our 70 to 74-year-olds vaccinated. And we need to get that lower age group vaccinated much higher, at least reaching the 50% mark. So I will end with my next slide is the percent of Marion County population fully vaccinated by gender. You will see overall that 42% are in our females, 30% are in our males. And so, thank you for that. And I'm going to ask Dr. Dean Paul Haverson. And I just want to thank you personally and publicly, Dean Haverson, for all the incredible work that your team and your faculty have helped to give our background information. And it's just been tremendous to have you as a true partner, especially your support for contact tracing of all of our cases that have been occurring in Marion County. That's such a critical component for infection control, that contact tracing. And so just appreciate you and ask you to maybe share a little bit more with us about what you are seeing with this data.
Thank you, Dr. Kane, and thank you, Mayor Hogsett, for the opportunity today to just bring a couple of words related to the decision of the city, and it's also great, Dr. Kane, to work with you. As you know, it's an important and strong partnership that the school has had and continues to enjoy. If we looked at the data taken as a whole, it certainly indicates the city is able to loosen the restrictions safely, and that's really important. The positivity rate and the daily average of new cases, as Dr. Kane explained, is low. It's not zero, but it's low. The prevalence of undiagnosed cases suggests that we have a significant buffer against additional spread. Now, let me explain that. We have, as you may know, in Indiana, one of the only random sample surveys that was done. In fact, it was done 3 times, supported by the state health department, conducted by the Fairbanks School of Public Health. We know as a result of that data that roughly 40% of the people that are positive are actually asymptomatic. And those are the people that don't generally get tested because they don't have symptoms. And so that element related to people that have had disease, actually that the disease itself, as they recover, infers immunity. And so that natural immunity from the disease, as well as the vaccination, give us protection. And that's why, in part, we can feel more comfortable in relaxing safely these restrictions. Cases across the state and the county and across the country are declining, which of course reduces the risk of disease transmission here. And as Dr. Kane mentioned, our contact tracing capacity allows us to feel confident in our ability to rapidly detect and to manage increases in disease spread should they occur. But I also want to reiterate what Dr. Kane and Mayor Hogsett have mentioned, which is so important. It is crucial that people get the vaccine for your safety, for the safety of your friends and your family. And as Dr. Kane has pointed out, there's a big difference by race, by ethnicity, and age. And I know that the new grant program, the small grant program working with churches and social organizations, that will make a critical difference. And we're so proud of the approach and the initiative of the health department to move in this direction. And we think that will go a long ways to helping. And although the mask mandate will no longer be in place for unvaccinated individuals, certainly our clear recommendation is that they should still wear a mask and maintain social distance and practice proper hygiene to reduce spread to others. And the other thing, I guess, that I would just say is it's okay for anyone to wear a mask for added personal protection if you choose. That's perfectly fine. The new normal may include a mask as part of the normal part of our wardrobe. And everyone should feel fine with the idea of you making the choice around whether and if you want to wear a mask, again, regardless of your vaccination status. But again, for those that have not been vaccinated, it is so crucial and important. At the Fairbanks School of Public Health, we're proud to partner with the Marion County Public Health Department as a resource for disease monitoring, contact tracing, and prevention and intervention strategies. And as we move into this next phase of COVID-19, it's great to see the progress that's being made, and we're glad to be part of the great team led by Dr. Kane and the mayor. And we thank you, Dr. Kane and Mayor, for the opportunity to be your partner and to appear today.
Thank you, Dr. Halverson, and thank you, Dr. Kane, and thank you, Mayor. As always, we'll do our question and answer session here following. Those reporters who are tuning in can put their name and outlets in the bottom right, and I will call on them and unmute them. So our first question is from Abdul Hakim Shahbaz of Indy Politics. Abdul.
Good afternoon. Can you all hear me? Yeah.
We can.
Mr. Mayor, thank you. Now that we're opening back up on July 1, we obviously had a good convention with the snacks people. I'm hearing a lot of concerns about public safety, particularly in the downtown area. The shooting near South Meridian, Envy's, Taps and Dolls, Tiki Bob's causing the city problems. IMPD being said that they can't be out there downtown because of overtime restrictions. Help folks that as we unmask, as we get back to normal, that the city is safe, open for business, particularly the downtown area.
Well, Abdul, thank you for the question. Obviously, any incident of gun violence is a problem that we are facing. I want to reassure everyone on the call that downtown remains the safest neighborhood in the city, period. IMPD does have a robust presence in the downtown area, and it will certainly be so this coming holiday weekend. We're continuing to work with downtown stakeholders on programs like our B-Link camera program or the Public Safety Ambassadors program. So we're continuing to make those key investments, and we will continue to look at ways that we best support the downtown community. I'm confident that we can approach the July 4th weekend with people coming downtown to enjoy fireworks and the celebration of our nation's independence. So I look forward to this weekend.
Thank you, Mayor, and thank you, Abdul. Our next question is from Leslie Bonilla at IBJ. Leslie.
Thank you. So I wanted to ask, when does this go into effect? Like, because you are matching the state and the level of restrictions that we're at, do you need city county council permission, or can the health department just go ahead and do this?
Paul, do you want to take that question? Paul Babcock?
Yeah, thank you for that question. So based on our legal analysis of Senate Bill 5, we believe because we're now in line with the state when it comes to these restrictions, we do not have to go to the city county council for approval. Though I just want to note on behalf of the entire Health and Hospital Corporation and the city, we do thank the council for their diligent work on approving and maintaining the restrictions for the last month and a half, 2 months. It was critically important, as it shows, Indianapolis works together to protect all our residents.
Thank you, Paul, and thank you, Leslie. Our next question is from Erica Heron at Indy Star. Erica.
Thank you. I'm just wondering, Dr. Kane, when we can expect to get some more school guidance. As you know, the mask mandate for schools lifts on July 1st. So I'm wondering, what are you telling schools at this point as they need to be making these decisions pretty quickly?
So we're having some considerable discussions with school leadership, but we won't have any final recommendations probably for the next couple of weeks.
Thank you, Dr. Kane. Our next question is from Sherry, also at the Star.
Oh, thank you, Dr. Kane. Can you tell me, are people, and maybe Dr. Halverson can still address this, are you still going to be doing contact tracing? And what happens in this day and age if you get sick with COVID-19? In other words, how much monitoring are you going to be doing from the health department? And are you leaving the door open that at some point you might need to walk back some of these easing of restrictions if we see things take a turn for the unwanted in the future and things, cases go up, positivity rate goes up?
So I'll take a first snap at it and Paul can pipe in. I think for us, it's really critical for us to have this ability to reopen, that we have to have a robust contact tracing process, that we've got to immediately reach a person who's positive, find out who their contacts are, put them on quarantine or isolation, make sure they're doing the social distancing and wear the mask when it's appropriate. So that's critical to making sure that we continue along this safe avenue that we've plotted for the community. And so that surveillance is very, very important. Paul, you may want to add some words.
Yeah, I would just add, Sherry, that contact tracing is really crucial. Not only is it great and important for an individual case management and close contacts, but as Dr. Kane mentioned, this allows us to have some boots on the ground in terms of an understanding of disease spread. It's generally not the case that it's related to just one person. There normally are a group of people that may have been exposed, and so it's really crucial that we continue the contact tracing. And to your other point, absolutely, public health is dynamic, and if we need to increase the amount of mitigation that may be necessary, in other words, we know that masks make a difference. We know that some of these restrictions have been life-saving. And if that happens, of course, we'll make that recommendation again. But we're hoping, based upon the data that we see right now, that won't be necessary. But it would not be responsible for us not to be constantly vigilant around the cases, and especially as we look at some of the variants. But again, the importance of vaccination, particularly as we look at making sure we can reduce the spread of disease.
Thank you, Dr. Halverson, and thank you, Dr. Kane. The next question I have is from Carson from Chalkbeat, Indiana. Carson.
Hi, Dr. Kane. I know that the county hasn't yet released guidelines for schools, but the state has, and it recommends that unvaccinated students, including students younger than 6th grade, continue to wear masks in school. And I also know that several Indiana districts have already announced that they're going to be mask optional. So I was wondering if that concerns you at all, knowing that there's definitely a lot of unvaccinated students, and they may be going into school this fall with no masks at school.
I'll just answer that one of the factors that we're trying to look at, we're trying to track that Delta variant, which is 40% more contagious than our original COVID-19 strain. And so trying to look at what that number is here in Indiana and trying to be able to predict the spread of that Delta variant in very large numbers for our school system, what will that look like? And so we're hoping that maybe another 1 to 2 more weeks will give us some additional answers or perspectives related to that. But we are concerned that there are children who are not eligible to be vaccinated 11 years and under. And so, and they may get infections where they can be asymptomatic, have no symptoms, and unknowingly be able to spread that infection to not only other kids in the classroom, but maybe some family members, grandparents that may be at really high risk for life-threatening complications. So we're trying to take that into context, but I also want to add one additional thing, and that's it is difficult for children to wear masks all day. And we've talked about not for just months, but we're going on and like into a robust second year. And it can impact their learning ability. But we're very conscious from a behavioral science standpoint. Are we experiencing any additional stress, anxiety, the ability to learn with that mask? So we want to take that all into context in terms of making a final recommendation to the schools.
Thank you, Dr. Kane, and thank you, Carson. And we've got one from Sierra Hignite, Wish TV. Sierra.
Hi, I just wanted to clarify. I know we've been talking about the Colts and them being the last NFL team to give that full clearance for fans. So I just want to verify that the sporting venues that are able to operate at full capacity, that includes Lucas Oil and Bankers Life Fieldhouse for the upcoming seasons and events, right?
I think that's a correct assessment. Thank you. Based on our recommendations. So, Colts, you can now remove yourself from being the last NFL team that doesn't understand what their capacity is, and they're at full capacity, and they better have a good season now because we're making this environment great for them. So I expect to be in the Super Bowl game next year.
All right, Dr. Kane with the June predictions. And then I think we've got one from, I believe this is Mary Mills. You're showing up as Mary, but I'll unmute you.
Thank you. It is Mary Mills. This is for Dr. Kane. Dr. Kane, this is a day so many people have awaited, but looking back over the last few months, it seems the goalposts for getting here have changed several times. How much pressure have you felt to get to this day? Because we've been saying July 4th, a lot of the other counties, the state, of course, open. What's that been like, the pressure?
So, Mary, I just want to tell you, I have to honestly say, the pressure's intense. You have so many different sectors that are trying to get to this point, whether it's a simple parent, whether it's a business, whether it's a healthcare system, and then, the people who continue to be impacted very negatively by being hospitalized, and some people have died. And so it's very tough when you have so many different perspectives related to this, and some of them are some very good points, but we have to make a decision about what's the overall best recommendation for the entire community in terms of them being safe. And there have been some unintended negative consequences that have occurred sometimes with these recommendations. So they're tough. Do I stay awake at night sometimes based on these decisions? I don't care what anybody tells you. Of course I do. Okay. And if someone tells you that they don't worry about this when they go to sleep sometime, what decision should I be making? Have I looked at all the evidence that I can? Have I tried to find out what kind of impact some of this data has had on other communities and what has been their response, what have been their results? So I've talked to a lot of people. We've talked to the Centers for Disease Control in person, sometimes a Zoom on a number of critical issues. We have some other partners funded by the Centers for Disease Control, Results Saving Lives out of New York, whose expertise and a lot of funding related to the school systems. And I've had to listen too. We have to listen to the school systems, I'll be honest with you. Our first initial recommendations that we had impacted all the schools, and the schools said we could do better. You can fix it so that everyone's not impacted if there's an outbreak at a school. We listened, we made adjustments, we made recommendations, and we're pleased with our efforts. but this was a very dynamic infection, evolving rapidly sometimes. It's a learning process of the science. And so based on that time at this particular point, based on the information we had, we tried to make the best practice recommendations at that current time.
All right. Thank you, Dr. Kane, and thank you, Mary. Those were the reporters I saw. If you have any follow-up questions, feel free to reach out to myself or the health department. Any follow-ups to these or anything else. So thank you for tuning in to today's press conference, and we will see you around. Thank you.